To discuss more on Mpox and how the Africa CDC says that it is not under control on the continent, we have Professor Oyewale Tomori. He's a virologist in Osun State. Hello, Professor Tomori. Good evening, and thank you for joining us at this time. Hello. Yes, I can hear you now. Good evening.
Yeah, thank you very much. It's my pleasure to join you.
All right, it's a pleasure to have you as well. Dr. Tomori, now the Africa CDC's Director General, Jean Kaseya, stated that Mpox is not under control in Africa, despite what so many healthcare professionals have actually said. What factors would you say contributes to the assessment, and how can this transmission be curbed?
Thank you very much. I don't know whoever said it was under control. When you said many healthcare workers said it's under control, it's not. You remember the WHO at one time declared a public health emergency of international concern. And that was about 2 years ago, and then they stopped it. Yeah, at that time, it wasn't about Africa they were talking about. They were talking about situation outside of Africa. The whole declaration was about what was happening outside Africa. Monkeypox never left Africa. It has always been with us. It has been situation even getting worse. In between 2002 and 2023, the number of cases increased by more than 60%. By the time we got to this year, 2024, it has gone up by more than 70%. So it cannot be under control. Many more countries are not being affected. Very close to DR Congo, Burundi, Rwanda, Kenya, Uganda, even South Africa is having cases. So how can you say it's under control?
Okay. Now, with 2,912 new cases reported in just 1 week, Professor Tomori, what's the estimated basic reproduction number for Mpox, and how does it impact control measures as a virologist? Please go ahead and tell us.
Yeah, you see, the biggest problem that we have in Africa, the solution to the problem is good surveillance. Find out the cases, trace the contact, isolate them, treat them, and you can bring the state under control. It sounds so easy. We've done it before. Nigeria did it with Ebola in 2014. We came to this country, within 7 months we cleared it. Simple surveillance, simple contact tracing, isolation, and treatment. There was no vaccine used. So why don't we go back to that basic test of disease control? We are waiting for vaccine. We are begging the world for vaccine. How many are they going to give us? 10,000 doses, 100 million doses for 100 million people? So Africa should wake up and bring its senses out. Go back to the basics. Go back to those basic surveillance things. Get the community involved. Get people to know that this is what disease is like. And then move on. And then when you see the cases, trace their contact. Isolate them. Treat them. And then we will see the end of monkeypox. That's what they did in Europe. It doesn't much of vaccination it is. So what are we waiting for? What are we waiting for?
Professor Tomori, what role would you say close contacts play in this transmission, considering that there are 15 African countries that have reported this case?
Yeah, when you look at the disease, the way it is, the contact, you first of all get this rash to your body. And then it becomes what you're used to, where you have a lot of pus. Without the pus, it's a lot of virus. And when that pus bursts, it contaminates the environment. Your table, your beddings, everywhere you are. Even the handles of the door where that person is. That's how it is easy to spread by direct contact. Of course, I show the fact that it's been sexually transmitted in DR Congo and other places. But even without the sexual transmission, having 1 or 2 cases around in a house means everybody is exposed. So simple like this, simple cleaning, simple isolation, infection prevention and control, those are the things we need to do in Africa. But we will not do it. We will go and beg for vaccine.
Still talking about close contact, Dr. Tomori, if you can hear me. Now, the WHO declared that the Clade 1B strain is a global health emergency. Now, can you help us understand the implications of this strain and also the concerns about vaccine effectiveness on this strain?
So there are 2 clades of the virus. That's what you call it Clade 1. In fact, it's not Clade 1A and Clade 1B. That's what you find in Central Africa, here Congo, down that way. In the West Africa, that Nigeria towards Liberia, we have what they call the Clade 2. The Clade 2 was not originally occurring in those two separate. But in 2022, another clade, what called Clade 2B, was the one that got out and became a major global thing. Right now in South Africa, they are in here to the sexual transmission. They're now having another one, what they call Clade 1B. That's what is spread now. So differentiating between one, we are not having too many cases being reported in West Africa. Not because they are not, but because our surveillance is not good. But it is we look at monkeypox as monkeypox, not whether it's Clade 1 or Clade 2. This is there that is raging and continues to rage. So what we need to do about vaccine, vaccine is the tail end of the control of this disease. Particularly when you don't have enough of the vaccine. The total amount of vaccine in the world, I'm not sure is up to a million today. Somebody is donating 10,000 to us. Another is giving 20,000. One is giving 50,000. What is that compared to the number of people that we need to vaccinate? And that's why I said we are abandoning our strength, which is surveillance, and facing our weakness, which is vaccine. We need to be sensible about how we do the control of this. With the world say one thing or the other. We in Africa should know what our problem is. We know where our strength is. We should make use of our strength. People have been controlling diseases for the last 50, 60 years. Last time was with us in 1961. The other people have been with us for over 100 years. Yet we've been able to control those things. Why are we not using those things? Why is our government not putting money into surveillance instead of begging for vaccine? That's the question I'm asking.
Okay. Now, we'll come back to surveillance, in a bit, but still talking about the strain, you did say that there are two types of strains already. Now, with 26,544 cases and 724 deaths reported, are there concerns about emerging Mpox strains aside these two that you have mentioned, or even mutations impacting disease severity?
Yeah, of course. What is happening when we are having mutation? The virus itself doesn't mutate as much as what you have with COVID. But this one will mutate because of changes in people's behavior. The large spread in Europe in 2022 was because of sexual relationship. Most of the cases occur through male having sex with male and otherwise, and also spreading it to the other women. The same thing is happening. When you compound that with the situation of HIV level of people with all the also malnutrition of that is, of course, the virus has a way to become more, because you don't have immunity and the abnormal immunity is low. When that virus comes, because the most severe infection, that we're having more deaths now. So those are the issues that we need to look at. Our people, the immunity level is low. And you remember, let me also say one thing. Smallpox, the vaccine, we related to smallpox, but there are other vaccines now. When they stopped vaccination with smallpox in 1980, that's what has happened. My generation and the generation before the change, we got the virus and we got the vaccine. So in a way, we are partially protected against monkeypox. But generation after that, that never got vaccinated with smallpox are the ones that are vulnerable, and that's what we are seeing. Young people are the ones that are getting it in those areas.
Well, Professor Tomori, now you talked about, we're still talking about the severity of Mpox in this particular case, and you talked about immunity level. Now, do genetic variations actually matter, especially in the Mpox virus influence transmissibility and virulence? And that's in your expert's opinion. I'm asking this because we're trying to consider the 177% surge in cases and also the 38.5% increase in deaths compared to 2023.
Yeah, that's the same point I was trying to raise. Now the disease is in an area of the world where, because of malnutrition, because of HIV rate or whatever, you are having that kind of reaction. Today, you are giving the virus that is coming in, being spread by two methods. You are spreading it within the community, the homosexual community. You are spreading it within normal families. And you've seen a lot of cases of pregnant women not getting infected and having an abortion. Those are all the parts of the severity we're talking about. Because when people change their behavior, they also change the pattern and the way the disease comes. Normally, the monkeypox, if they go there, the monkeypox would have remained within the monkey family if they are not getting involved with the trapping animals, collecting rodents, and all those kind of things. We don't even know the total number of the different reservoirs of the virus. So we don't know what we're dealing with. So those are the areas we in Africa should begin to look at. Where are the hosts of this virus? Which kind of animals concern them? If you don't know them, you don't know when you're contacting them. This is where a government should come and put money. It doesn't cost $1 billion. The money that my president will use to buy a jet or whatever will stop this problem within a moment. You need to do surveillance, that kind of thing. That's where we're saying. They call us resource limited. That's what they call us. We are not resource limited. We are resource wasteful. That's the difference. And then we deceive ourselves that we are resource limited. We are not. We are resource quantity, resource wasteful, and that's where we are today. We have to get priority. Our priorities in the wrong direction. And people are dying of diseases, our leaders are writing the best passport all over the world.
All right. Well, thank you so much, Professor Tomori, for joining us and speaking to us, on this particular topic. We really, really appreciate you for going all out to make sure that that you give us insights into this particular Mpox surge. Thank you. And that was Professor Oyewale Tomori. He is a virologist in Osun State.